Hi, I'm Garrett. This is the knee X-ray. Okay. Viviana Cuevas.
Yes.
Along with me. We're looking at your right knee. Is that correct?
Mm-hmm.
Okay. What's your date of birth?
10/31/83.
Okay. And who's the doctor that ordered this?
Dr. Smith.
Okay. Maybe lay down on the table, please. Is there any chance of pregnancy?
No.
Okay. Maybe lay down on your back. Go. Okay. So I bring my table all the way up. My distance is going to be 40 inches from the table. I have a 10 by 12 cassette in lengthwise. And the first one I'm going to do is the AP knee. So for that one, I'm going to have the toes straight up. And I have my central ray a half an inch distal to the patellar apex. So right here. I'm going to use my marker to mark it, showing that it's the right knee. This is a lead shield I'm going to place over your lap to protect your reproductive organs. Okay, I'm then going to x-ray her the technique about 60 to 70 kVp at about 20 to 25 max. And what's that? X-ray. Okay, for the next one, I'm going to switch out my cassette, keep it with a 10 by 12 lengthwise, just like that. And what I'm going to do is an oblique knee with medial rotation, or internal rotation. So for that, everything's exactly the same. We're still at a half inch distal to the patellar apex. We're just rolling in the foot, we're internally rotating the leg 45 degrees. There we go. Okay. Again, using the right marker to show that it's the right leg. Keeping her shielded, just like that. I'm going to come back, and for this one, we're going to do about the same technique, 60 to 70 at about 25 kV, and x-ray. Alright, done with that one, I'm going to switch out my cassette. For this one, we're going to do a lateral. Keeping the cassette 10 by 12 lengthwise. This time we're going to angle our tube 5 to 7 degrees. Make sure we're lined up again. I'm going to have the patient roll to the affected side, so I'm going to ask her to roll up to her right side. Okay, for the lateral, I'm going to ask the patient to have the unaffected leg roll over in front. This one is going to, the affected leg is going to be bent at a 20-degree angle. Tube again anywhere from 5 to 7 degree angle. Cephalic. Okay. I'm going to use my marker, mark the right side. Okay, and I'm going to have the central ray perpendicular to the condyles, just like that. Do my technique at about 60 to 70 at 30. And keep her shielded, and x-ray. Okay? Alright. We got 2 more exams to do for the knee. This one is to show the intercondylar fossa, known as the Beclaire method. I have the patient sitting or supine, she prefers to sit. And I have the part positioned as such. There's an angle of 60 degrees between the femur and the long axis of the tibia. We have this wedge underneath her holding the cassette, an 8 by 10 cassette crosswise, just underneath the back of the knee joint region. We're shielded right here on the lap. My distance is 40, and we have this perpendicular to the axis of the tibia, or just perpendicular to the knee joint, centered just at the bottom and below the knee joint. And alright. My technique is going to be about 55 to 65 at about 20 mass, and that's that. X-ray. Boom. next one, I'm going to look at the patella using the Settegast method. So for this one, I'm going to take this and ask the patient to lay down. I'm going to set up my tube of stretch. Ask the patient to hold the cassette in her hand just like this. Excellent. Okay. So I'm going to have 40-inch distance. My technique is going to be about 55 to 60 kV at about 10-15 mass. And center just 2 to 3 inches from the lower edge of the interceptor right here. And right here we're perpendicular to the space between the patella and the femoral condyles. And that's that. I have her shielded right here. And that's it. X-ray. Done. I just wanted to add that I did have my right marker on the cassette to show that it was the right knee for both the Beclair and the Settegast methods. Okay. Alright, now that we have our knee radiographs completed, we're going to go over the criteria that we assess for all 5 positions to make sure that we obtain an acceptable knee x-ray, knee image. So I'm just going to go through those. Starting right here, we have the AP projection of the knee, is that one. The criteria we look for is we want to make sure this femorotibial space is open. The head of the fibula should be slightly overlapping by the proximal tibia. The patella should be completely superimposed on the femur, and the joint space should be equal distance on both sides of the tibia and the femur right here. Okay. Next, we did a medial oblique image as well. So I'm going to go over what we look for with that. First, we look for the tibia and the fibula should be separated and at their proximal articulation. The lateral condyles of the femur and tibia should be visualized also. This knee joint space obviously should be open. Both the plateaus should also be visualized as well. So that's that for the medial. We also did a lateral, so I'm going to go over that as well. Something we look for here is the femoral condyles should be completely superimposed. The patella should be projected in the profile. Usually like to see a little gap in there, right here. Yep, right there. Anyways, the femoral patellar space should be open, as I said, and the fibular head and the tibia should be slightly superimposed. Alright. We also did, let me see here. Right here, we did a Beclair method in order to try and get the intercondylar fossa. So I'm going to go over the criteria involved with that one. The fossa should be opened and visualized. It's going to be right here. The apex of the patella should not be projected on the fossa. Posterior surface of the femoral condyle should be visualized, and the leg should not be rotated as evidenced by slightly overlapped of the proximal tibia and fibula. So that's that one. And then last, we also did a Settegast projection of the patella. So I'm going to go over that. We just want to see the space right here in between the tibia and the fibula. It's like the main thing that we look for. So yeah, patella should be seen in profile, and the femoral condyle should be visualized. And that's that. Those are all the criteria for the knee x-rays.